Breaking news. So as of December 11th of 2025, Congress decided not to extend the enhanced subsidies that they were given away for the pandemic and for the years to come. Now, Democrats and Republicans tried to figure this out during the government shutdown, and I am not to be one that is too political on this channel, but this does affect how health insurance works in the United States. So, what happened is on both ends of the aisle, the Democrats could not reach 60 votes for their plan to extend this out for 3 more years. So the pandemic subsidies that they were giving out, they wanted to keep doing that for 3 more years. On the Republican side, they wanted to go ahead and introduce a limited health sharing account plan that would help alleviate some of the high premiums that we're seeing right now, but to no avail. So they did not come up with a conclusion. Now, a lot of people have been seeing the renewal notices, and people know that health insurance premiums are pretty high these days. The carriers are raising their premiums and the subsidies are lower now. And this has affected both plans and also premiums, plan copays, and the actual premium of the plans. Now, what are some solutions to this that I'm coming up with at my agency? I did call this because if they wanted to do something, they would have done it in the first go around, not duke it out in the middle of open enrollment. So I'm a solution oriented person, especially for my clients at my health insurance agency. Now, some solutions that I've been coming up with for my clients are just having a very real conversation with them based off of their projected income for 2026, if there's any changes in the household, if there's any changes in their zip code where they're at now, just to see if there's anything I can do to make sure that these policies are going to be affordable moving forward. Now, again, there's speculation that Congress is trying to do something, but this kind of stuff just does not, you can't just repeal a full system that's been around for a pretty long time now. It's just not realistic right now. So we'll see how things pan out, but I do not want to be one of speculation. I want to be one that wants to solve the issue at hand and give advice where I can with the circumstances that we're in right now, right? I am not one to shy away from, you know, giving solutions out during these times, right? We have to do something. We can't just sit around just because the government wants to keep battling it out and affecting the livelihood of American people. So, my solutions that I have been suggesting are if you're on a silver plan, maybe consider a bronze now because the biggest difference between a bronze and a silver, especially in a state like California, the out-of-pocket maximums are going to be pretty similar on both plans. So the out-of-pocket maximum means it's the end-all be-all number that you would have to hit to have coverage at zero, or sorry, your bills at $0 after you hit that out-of-pocket maximum. So it's the end-all be-all number that, let's say if you had $100,000 bill, then you're only on the hook for 9,800 of it, right? That's the cap. Now, what a lot of people are going to miss out on in the bronze plan is a specialist visit right away in certain scenarios, right? You'd have to meet a deductible first, and then you can go see a specialist. Up until then, it's going to be out of pocket, and any other type of services in between that's not a primary care visit or generic drug medication or preventative care, there will be a deductible applied. Now, on the silver plan, there are the silver 73 plans that had the $0 deductible of during 2025. And a lot of people are moving over to a Silver 70 based on their income if they had Silver 73 as part of this enhanced subsidy that they were getting. Now, all these numbers basically mean the percentage of how much the plan actually covers. So 73% coverage versus 70% now, meaning that you would have to have a $5,400 deductible if you have to go into inpatient or outpatient care first, whereas in 2025, because of these enhanced subsidies, and pretty much anybody could have qualified for this at any income amount, as long as you're not lower income. If you were at a decent income and you had maybe a household of one or two at about a 50 to a and up, right? 50,000 and up based income for the annual projection. Then that Silver 73 plan this year was a $0 deductible. Now it's going to go to 5,400 for next year. So there's some slight changes there. A lot of people that are lower income won't see too much of a change, except for on the Silver 73, there will be a deductible. On the Silver 87, there will be still a slighter increase in the out-of-pocket maximum, and the Silver 94 is still going to be a pretty low cost plan because there's a small window to qualify for that. Now, 94% of coverage is going to be more than the platinum plan itself. So if you do qualify for that, you're really not going to see that much of a difference. And you have to be pretty close to the Medicaid line. So those are some changes that are happening, and a lot of people are reconsidering a lot of options. Now, there also are privatized plans that people are looking into. Now, I want to proceed with caution when I talk about these privatized plans. Some of these plans are not minimum essential coverage plans, meaning that you would still have to pay the tax penalty. Of course, there's going to be health underwriting involved as opposed to just qualifying based off of your income. Now, if you are under the qualification, I call it healthy and wealthy, and now it's not even too wealthy these days just because of all that's happening and just the livelihood and cost of living. But if you have a higher income than most, then some people are considering this option because in states like California that have a tax penalty of $900, if you divide that into 12, that's $75 that you pay. Now, if your premium is a lot higher than that with the 2026 rates that you were just mailed out, then people, of course, are considering these options, especially if they're healthy and quote unquote wealthy, right? You're making enough money to get by. So some of these plans can work out, especially if you're not really going to the doctors all too much or going to the emergency room every other month, then these plans are definitely a type of plan to look at. But again, you do need to know all the catches of these plans before you enroll into them. And I do that at my agency, and all my agents do that as well too. So we walk you through the pros and cons of having that, and we do proceed with caution. But if you are a good candidate for this and you do understand how all of this works, then of course this will be a good option to save money. Now, a lot of people who have PPO policies, they have been affected the most. Again, the two prominent carriers in California for PPOs, it's going to be Blue Shield and Health Net. Now, these are the people that have seen astronomical numbers. These are the people that have seen a higher premium more than most HMO plans or bronze plans. PPOs, again, there's two options in California, so you do the math on, how that how that all works out. But a lot of these PPO carriers have risen their rates, and because these enhanced subsidies are gone, at that point we would have to consider even going direct to carrier if there's no subsidies that you're receiving because you're a high income earner. Because sometimes if you go direct to carrier, there could be a slight difference in premium and a slight lower premium at that. So a lot of people are considering those options as well too. Now, If any of this does not make sense, feel free to, of course, reach out to my agency. And my phone number here is 323-844-8471. And we can definitely customize your options and have a realistic conversation for a 2026 start date because we are right in the middle of open enrollment right now. So having that realistic conversation is one, going to give you peace of mind. Two, it's going to, at the very least, give you closure on what's happening with everything that the government is doing. And number three, of course, I'll customize options for you so that at the very least, we have a game plan moving forward for the next year. I pray that they do make changes for the better. And if there's any other type of help or if carriers decide to lower their premiums, of course I'm going to be the one to tell you all because I think it's criminal. Healthcare is a right, and universal healthcare is a dream at this point, and it's just something that's not attainable with the climate that we're in. So again, I am solution oriented, so I just need to make sure, and this is the reason why I make these videos, is because I need to make sure that everybody is taken care of, and I take great care and pride in making sure that my clients have an affordable rate or at the very least closure. So hopefully this video helped. If you did like this video, please like and subscribe. And I understand that it's a heated time right now, especially with people's livelihoods changing because of these premiums. And for people that have prior authorizations that need this health insurance to get their surgeries, to get their treatments done, I totally have a heart for you. So please comment below on what your situation is, and I'd be happy to answer that and even set up a consultation with you. And of course, we work for free on this, and we get credit by the carriers that you end up going with. We are covered California certified enrollers and also ACA licensed certified enrollers as well too. So we know a thing about this because we're in the middle of the battlefield here, right? We're boots on the ground. So this is what we have been doing. We've been talking people off a ledge of saying, "Oh, I'm just going to take the penalty and it is just what it is." Some people can qualify for a subsidized policy at a decent rate, and some people are are surprised that their premiums are still intact in certain income brackets, if not lower, because of the job market right now and just unemployment. So, if you need clarity on this, please feel free to reach out to me, and more than happy to assist. Thanks for watching.